I know that you practice in a rural area in South Carolina, and it's my understanding that a lot of the rural southeast of our United States have a challenge with accessibility to medical treatments. So some patients do not have primary care physicians. Some patients do not see doctors on a regular basis. So if someone is out there, first, of course, we would encourage them to have a primary care physician relationship. But if they don't, what kind of symptoms physically would they begin to feel if they were going into 3A, 3B?
Well, of course, as you mentioned, we encourage every patient to have a regular follow-up with their primary care physician. Unfortunately, kidney disease is like high blood pressure. It can go a long way before it started to manifest itself with symptoms. The patient could have advanced renal disease, even stage 4 or even 5, with very little complaint. The patient may have some symptoms, but the symptoms come slowly and subtly and gradually, so the patient doesn't even feel it. The patient may have a hemoglobin of 6 or 7 and don't even know that he's anemic. The patient may have a potassium of 6 or 6.5, and he doesn't know he's hyperkalemic. The patient may be having acidosis and acid load is higher in the body. The patient doesn't recognize that. The patient may be fatiguing or losing weight and muscle wasting and appetite is poor and energy is low. But because it comes gradually and subtly, most of the time the patient doesn't recognize the symptoms until it is really advanced and late. So depending on symptoms is a wrong thing. The patient has to have a follow-up. The patient has to have a close monitoring. And annual checks-up is extremely important. Urine analysis, blood chemistry, hemoglobin, blood count, all these kind of things routinely done and periodically done is recommended and advised strongly.
I see.